Welcome back to the Data-Driven Wellness Expert Interview Series. Today we have Dr. Maes Hughes, who is a pelvic floor physical therapist specializing in helping women through pregnancy, postpartum, and pelvic floor health. She's a doctorate in physical therapy and is passionate about teaching women to both prevent and treat pelvic floor dysfunction. She said, which I love, quote, "Bringing a new life into the world doesn't have to mean the end of our own body as we know it." And even outside of pregnancy, Dr. Hughes sees people who are having pelvic floor dysfunction. And this is a pretty common thing, yet it's something we don't really talk about a lot in the US. I've recently come across some pelvic floor issues, reached out to Dr. Hughes. I was like, I would love to have you on to educate the data-driven wellness audience on this, because I think it's really important. It can be some taboo symptoms, but we need to be talking about this. Dr. May is also a dear friend of mine from Vanderbilt, so it's great to see you. Thank you for coming on.
Yes, thank you so much for having me. It's so fun, not only just doing interviews and podcasts, but especially when it's someone from college or one of my friends or just that special connection. So I'm so excited. I just love talking about the pelvic floor in general. So can't wait.
Thank you. And yeah, we were just catching up a bit before we started recording. And just a little fun fact, my first ever Barry's boot camp class was with May, and we went our freshman year at Vanderbilt in 2013, before Barry's was as popular as our claim to fame. We discovered it in Nashville, but Eli Manning was in my ever first Barry's boot camp class. So just a fun fact.
Oh my gosh, that photo, we look like children.
Literal babies. Okay, so let's jump in. Can you familiarize people with what even is a pelvic floor? Is it a muscle? Is it a ligament? And I will say, I was mentioning this to you before, as someone who's pretty entrenched in the wellness world, until I had my own issues come up, I hadn't even heard of a pelvic floor, which is crazy. And so I feel like this needs to be more talked about. And let's just start with the very basics.
Yes, and I find that it's important to start with the very basics because people don't know what the pelvic floor is. So I have my handy dandy model here. I take it everywhere with me. I have, I have some at home. I have some in the clinic. So pelvic floors everywhere. This is a female model, but I do want to start by saying this: males have pelvic floors too. Everyone who is born has a pelvic floor. So everything you see in red is a muscle. So pelvic floor is a group of muscles as well as ligaments. You can see in white here. So it doesn't have all of them, but muscles and ligaments that help to support different functions of your body, such as supporting your pelvic organs that would sit right here in this bowl. They help with sexual function. They help with sphincteric function, aka peeing, having bowel movements. And then they also they pretty much just support the bottom of your core system, as well as support your baby if you are pregnant or planning to get pregnant. Your baby will be right here in this bowl, and the pelvic floor muscles will stretch a little bit and work to just help support your baby.
Cool. And yeah, you mentioned different things the pelvic floor helps with. And I mentioned that I recently came across it. And when I was first introduced to the pelvic floor was for IBS type symptoms.
Yeah.
And I had no idea that could be related. So just my story, that's interesting. How might someone know if their pelvic floor needs to be strengthened or if they could benefit from pelvic floor physical therapy?
I always say first line of attack would be to reach out to a pelvic floor physical therapist. And actually occupational therapists can be trained in the pelvic floor as well. So you'll just hear me say pelvic floor therapist because it could be a physical therapist or an occupational therapist. But is the gold standard, just to go have an internal exam to see if your pelvic floor muscles are too tense or too weak or a combination of both. But some general signs of pelvic floor dysfunction are going to be if you're having any sort of incontinence, so urinary incontinence or fecal incontinence, any sort of pain with intercourse, generalized pelvic pain, feelings of heaviness in the pelvis, if you're having, constipation or digestion issues. You were kind of mentioning some of the IBS, and it's a hugely underserved population, even in the pelvic floor world. And just low back pain, hip pain, all of those can be related to pelvic floor dysfunction because as you can see here in the model, the pelvic floor is super close to where the hip muscles attach. So if the hip muscles are back here, pelvic floor is here, it's tight real estate down there in the pelvis. And so I do work with a lot of women who have back pain or hip pain, and the pelvic floor is kind of the missing link that maybe their, traditional physical therapists kind of miss because they weren't trained in the pelvic floor. I also work a lot with women who have core dysfunction, so any sort of like diastasis or hernia, or if they've had, like a hysterectomy or any sort of like abdominal surgery. Anytime you go into the abdominal cavity, your pelvic floor and like the full core system is affected. And so I'll work with women through those as well.
And if someone's not pregnant, but they're having pelvic
Mhm.
floor dysfunction, is there a particular cause of it? Like, I'm even just wondering, like, could you have too strong a core and that could cause dysfunction, like doing too many sit-ups or not enough sit-ups? Like, what causes it?
Totally. You can have, there's a bunch of different reasons that can cause it. So if you have, a lot of times I see women who have too tight of a pelvic floor are gripping their abs all day. They're squeezing everything. They're sucking in. Maybe they've been told to do Kegels throughout their pregnancy. And believe it or not, just like anything in your body, like if your bicep, if you're keeping it really tight all day and then you ask it to hold something and work, it's going to give out because it's exhausted from doing work all day long. So that's what can happen sometimes if your pelvic floor is too tight from like gripping and clenching, or maybe you have a lot of stress in your life where you grip and clench. A lot of times we're clenching our butt cheeks, clenching our pelvic floor. Then when you go to call upon your pelvic floor during an exercise, when you're running or jumping, when you actually need it to support your body, it's so exhausted from working all day long that it gives out. And that's when you have maybe some sort of leakage or something like that. So I actually see a lot of women have too tight of a pelvic floor who are maybe more high stress. There's, more external stressors in their lives, or they love to work out and never take breaks. They're kind of like chronically doing high intensity boot camp classes and things like that. And then on the flip side, for women who maybe have too weak of a pelvic floor, usually it's immediately postpartum, or maybe you've had like a nerve injury, like actually physically affecting the communication of your brain to your muscle, or if you've had any sort of surgery. Anytime you disrupt the integrity of tissue, whether it be muscle or ligament, the healing of that tissue is going to be a little weaker. And so you have to work on re-strengthening it. I actually see a lot more pelvic floor tension than people would think.
You know, we love the data and like the research and the correlations. And I just remembered on your page, I want to say a few weeks ago, or maybe I was like stalking the highlights, you talked about a correlation between jaw clenching. And
Mm-hmm.
I thought that was so interesting. And I'm reading it as I'm like clenching my jaw. I'm like, okay, it makes sense. But can you talk about that?
Yeah, the amount of people that like messaged me or my friends that texted me, they're
Yeah.
like, "Oh my gosh, I like needed to breathe when you said that," or like, "Let go of my jaw."
Yeah.
Um, you. So there is once again like correlation, meaning we don't know which causes which. It's just like pelvic floor dysfunction and like TMJ pain or jaw pain are correlated, and the theory behind that is the clenching theory. So when you're in a high stress environment, your body tends to clench up, and it does so through the holes that you have, one of them being your mouth, one of them being kind of like your vulva. So 3 holes of the pelvic floor if you have your vaginal opening, the anal sphincter, and then the urethra. So clenching up all of those holes. There's just a strong correlation. And I even see it in my intake forms when on initial evaluation, a patient comes in, I include TMJ pain in there, or like jaw or headaches, things like that, because it usually gives an indication that this person might be clenching, or maybe they have some external stressors in their life that are probably going to contribute to pelvic floor tension resulting in dysfunction. But yeah, I don't know the exact percentage, but there is a correlation between the two. It's just from stress.
Oh my gosh. It's like you hear about stress a lot and how I feel like everywhere it's like stress correlates to this or stress is bad for this. And I think when you have these conversations and it breaks down, it's like, because stress can manifest in so many different things, and like clenching in different ways is one of them.
Yeah, you just end up like clenching up or holding your breath, or maybe you're not taking big, deep breaths. You're kind of like staying in this upper body chest breathing. And that's just what I see a lot, honestly. But I think sometimes people think stress always has to be, a traumatic event in life, but it really doesn't. It could just be, the world that we live in, small little things happening all the time, or the food that you eat, not to go down a tangent.
Oh yeah, no, that's a whole conversation we can have too. Totally.
Yeah.
So why do you think that pelvic floor therapy, pelvic floor education, why do you think it's not commonplace in the US especially? And I saw that you said or wrote somewhere it isn't
Mhm.
commonplace in the US, which makes sense to me. So question one is why do you
Yeah.
think? Two, are there other places in the world where it is more commonplace, or do you think it's generally just not talked about a lot?
I would say here in the US, we typically have a reactive response to things in our medical system. We're working on trying to be a little bit more proactive, but I would say honestly, probably the main reason that pelvic floor and just like physical therapy in general is not promoted as much as a solution to aches and pains is is because the US kind of has more of a medicalized approach in that, okay, you must be having like a specific issue, and then we're going to maybe try an X, Y, and Z. And maybe physical therapy is like the last attack. Maybe you're going to try this certain drug first or this certain, medication, whatnot. And then maybe at the very end, you might try physical therapy. But specifically for the pelvic floor, I would say, I mean, not a lot of research was done on women for a long time. And I think pelvic floor therapy really became more popular through pregnancy and postpartum. Even though a lot of gynecologists, refer out for physical therapy for, males, females who are having urinary dysfunction. But yeah, I just think it's not super common because it's seen as more of a holistic approach, and then the United States just doesn't have as well-rounded of an approach to medicine as I would like. And other countries do a fantastic job of getting pelvic floor therapy out to the masses. France, for instance, I want to say, don't quote me on this, but I do want to say they get 12 weeks of covered pelvic floor physical therapy after they've had a child, and it's covered by their government insurance. And I've had multiple, you know, people from across the globe respond to me in their messages being like, oh yeah, like this is standard of care here in France or in Australia, at your 6-week appointment, you always get a referral to pelvic floor physical therapy. So it's been really interesting seeing people from across the globe reach out to me saying, this is what everyone here does, or it's not hard to find a pelvic floor therapist. It's super accessible because there are so many pelvic floor therapists because the medical system values them. Part of it too goes down to educational systems as well. Sometimes I do feel like there are many OBGYNs and midwives who don't receive the education on what pelvic floor therapy could help. And so if they aren't aware of situations in which pelvic floor therapy can be helpful, then it's not necessarily their fault for not referring. They just weren't provided that information during their educational years. So there's a couple of factors here in the US as to why I think that's occurring.
That makes sense. And I also hypothesize that on the end of potentially like looking at it through a different lens, sometimes these symptoms can be embarrassing to bring up or talk about. And maybe
Mm-hmm.
I feel like as women too, like a lot of times we're conditioned to just be like, oh, it's just being like part of being a woman, or like
Yeah.
that's that's normal. And I just want to say to people, like, you can get help for these things. Don't be afraid to bring it up to your doctor or advocate. Say, I think I need pelvic floor physical therapy. Like they can push
Yes.
back with you. And I think the more we can reduce the tabooness around
Yeah.
this, like if you're having incontinence issues, like march in there and tell them and say, I want to try pelvic floor physical therapy, and
Yeah.
shouldn't be embarrassed about it, because I feel like sometimes women hold these things to themselves.
Mm-hmm.
They don't want to talk about it. And then
They do.
better. And it's a shame.
It really is. And, that's part of why I started the platform that I have, is just to get to women directly, right? Like, let's just go and educate everyone directly so that that way when they go into their 6-week appointment, or just if they've never been pregnant, if they just go in to their, primary care provider because they're having pelvic pain, they can say, I want to do pelvic floor therapy, or at least give it a try, something like that. There's great providers, not so great providers across the entire spectrum. There's great physical therapists and there are not so great physical therapists. And so sometimes, I still hear stories of women just kind of going into their appointments and they're just kind of dismissed as like, that's just part of having a baby, or, that's just part of turning 30 when you're a female. Those are just some responses that you're like, oh no.
Totally. So find someone like Dr. May here who can. Okay, so we talked a little bit about pregnancy. I do a lot you do a lot with people who are not pregnant, but you also do a lot who are pregnant, sort of a specialty. So starting again with the basics, like how does pregnancy affect your pelvic floor? I have my hypotheses of like, well, obviously a lot's changing down there, but just like structurally tell us.
So during pregnancy, as you can imagine, as your baby's growing inside of your uterus, that is one of the organs that your pelvic floor supports. And so as the weight of baby grows, your uterus, amniotic fluid, all of that is just additional weight pressing down onto your pelvic floor. So your pelvic floor physically has to support it. And so it has to be strong enough to support those organs. So that way they're like in an optimal position and things like that. However, during birth, your pelvic floor needs to be able to be mobile. And I think that's a common misconception is people think I need to be super strong in my pelvic floor during pregnancy so that my pelvic floor can help push out my baby. And your pelvic floor does not help push out your baby. Yes, it needs to be strong to help support the weight of your baby and help kind of reduce pelvic heaviness and pain, but it also needs to be mobile during birth because it spreads apart. Your pelvic floor actually gets out of the way, things like two curtains, like opening, so that way your uterus and your abdominals can push out your baby. So your pelvic floor, it needs to be like any other muscle in your body. It needs to be strong, but it also needs to have good range of motion. So that's a big misconception that I hear is pelvic floor needs to be strong to push out my baby. And then during birth as well, if you've delivered vaginally, your pelvic floor can stretch up to 3 times its normal length. So in order to birth your baby. Crazy, right? So you can imagine that's that's a lot of stress to your body. Think of it as, a muscle strain. So say you're playing soccer and you strain your hamstring. The way that the medical system grades your hamstring is on the amount of stretch that occurs during that injury, during a muscle strain. And so a grade 3 is obviously a complete tear of the hamstring muscle versus a grade 1 is maybe less than 50% of the muscle is torn or stretched. And then grade 2 is usually 50 to 75%. And that's usually a way that it can help people to kind of visualize and like conceptualize, oh, when my pelvic floor is stretching, it's actually, there's like micro damage that is occurring. And especially if you have any sort of tearing anywhere around your pelvic floor during a vaginal delivery, think of that as your grade 3 muscle strain. So it's going to take a while for that muscle to heal because you tore those muscle fibers. And one thing I'll also say is a lot of women think if they have a cesarean delivery, their pelvic floor is not affected, but you still go through, 9 to 10 months of pregnancy with the additional weight of your baby pressing on your pelvic floor. And not every first time birth, that you're going to have a C-section. A lot of times, maybe you're pushing or you're going through labor and your baby's still progressing through the birth canal, pressing on the pelvic floor and stretching it. And then at the very end, they're like, oh, we need emergency C-section for, any sort of reason. So pelvic floor is definitely still affected with cesarean deliveries. I want to put that out there.
I was going to ask that. I was like, does this all go out the window?
Yeah. And I have a lot of people ask me, oh, should I just, have a cesarean delivery to avoid like any effects of the pelvic floor? And, if you've been pregnant for 9 or 10 months, your pelvic floor is still affected. And you then, with cesarean deliveries, maybe your core is more affected than your pelvic floor. And so there's always like a give or take trade-off.
Yeah, that makes sense. So I get how it's affected. Now, what can you do, or like, why is it important tactically to, I guess more the how, like, how do you strengthen it? Or if you're working with someone, are you like, okay, here's a program for how we're going to help you like literally support your baby? Or like, what do you do in pregnancy to like set that up for success?
So I work with patients in person and also have an online program, and kind of I follow the same guidance for both the online program and my in-person patients. First thing is just let's find your pelvic floor. Like, can you actually, like, do you know how to contract it volitionally? Do you know how to relax it volitionally? Like, let's just bring awareness of your mind to your pelvic floor. and then connecting it with your breath work. So breathing is the most important thing for the pelvic floor because your full core system, think of like a soda can. Your diaphragm, which is your breathing muscle, is the top of the soda can, the pelvic floor is the bottom, and then your abdominals are kind of, and your back muscles are the entire sides of the soda can. And so both the diaphragm and the pelvic floor help to maintain optimal pressure within that soda can. And you can imagine if you crush the top of the soda can, it's going to make everything explode or vice versa. And so breathing is really important to make sure that you're maintaining optimal pressure within your core system, which affects your diaphragm and your pelvic floor. So first, let's find the pelvic floor. Then let's work on optimizing your breathing to make sure that you're fully lengthening your pelvic floor and you're fully contracting it. Then let's incorporate that type of breathing into your full body workout routine. I'm not a huge fan of doing just isolated pelvic floor contractions or pelvic floor relaxations forever, right? I think it's important to learn how to do that. Just like you want to know how to contract your bicep, you want to know how to relax it, but you never just work your bicep in isolation. You're always like doing something, you're lifting something. And so it's the same thing with the pelvic floor. You're never working on just the pelvic floor in isolation. Now, I will say there's always going to be exceptions, right? If someone had like a nerve injury and they truly need to learn how to just contract it, then yes, we will probably spend more time on just isolated contractions. But for most women, it's finding pelvic floor, learning how to breathe, and then incorporating that breath work while they strength train. And as well as incorporating certain types of movements during pregnancy that optimize the pelvic floor. So without getting too like biomechanical, nerdy, internal rotation of your pelvis. So when your legs are going in, actually helps to lengthen your pelvic floor versus when your knees are going out into external rotation, like a clamshell, that actually shortens your pelvic floor. And so you can imagine towards the end of pregnancy, when you're trying to lengthen your pelvic floor and get it ready to spread apart for birth, you might want to be doing more internal rotation, knees together movement to help lengthen the pelvic floor. And so that's why it's really important to work with someone during this time period, during pregnancy, to help optimize your movement, because there are certain movements, just like in a general strength program, that don't pay attention to the pelvic floor or work on your breath work or work on your rib cage mobility. All of those things, like kind of related to your core system, impact your pelvic floor. And so it's important to try and at least schedule, one appointment or follow a program that is super specific for your pelvic floor during pregnancy. But yeah, really full body movement is what I try and get everyone to. Sometimes people stay a little bit longer on just isolated pelvic floor work, but really the goal is full body movement because you don't work your body on your back. You're moving around all day long, standing, kneeling, squatting, that sort of thing.
You talk about breathing. Is this different than meditation, or do you ever incorporate meditation into this practice too?
Yeah, I incorporate meditation a lot in women. I keep saying women because I only work with women, but this all applies to males as well who have, a really tight or relaxed pelvic floor. So I work with a lot of women who have a lot of tension in their pelvic floor. One of the techniques is it's called down training. So you're kind of down training your sympathetic, which is nervous system, which is like your fight or flight. So you're trying to increase your parasympathetic, which is your rest and digest type of nervous system. And so one of the things that I'll frequently do is turn off the lights in my office, put on some calming music, just having them tune into their breath. And that can be a form of meditation. I really think everyone should be doing like 5 minutes even of whatever your version of meditation is. If you just someone who needs the lights off, calming music on, that sort of thing, or maybe you need an actual guided meditation. But either way, I do use a lot of like down training when you have a tight pelvic floor.
That makes sense. And that makes sense.
Mhm.
You want to like relax things out of the sympathetic into the like, okay, now let's get into.
Exactly.
So I've known you for a while and like,
Mhm.
so cool to see you on this journey. And I've never asked you this exact question, but why did you choose pelvic floor physical therapy? And then you do all types of women, but especially niche in the pregnancy and that whole journey. Like, what was your motivation behind that? Why are you so interested in this work?
So I started off actually right out of physical therapy school doing a residency in the sport and orthopedic world. So I worked with professional and Division I athletes that came through Vanderbilt Hospital and Vanderbilt University with all their student athletes. And so I always thought I was only going to do like sport orthopedics. I went through certification for strength and conditioning coaches so I could program high level athletes. Like I said, working with professional and Division I athletes. But it was during that time, during my residency, that I was working with some high level cross country runners and track athletes who were having these concerns, and they would get comfortable enough to share them with me of like, hey, I actually like pee on my run, or is it normal to like lose control of my bladder on like a long run? And I truly was like, you know what, I don't know enough about this. Like, I know we had 2 lectures on pelvic floor therapy, but that's what I'm talking about. Educational systems don't really do a good job of even providing you with information on pelvic floor therapy, because in physical therapy school, we got like 2 lectures on this is the pelvic floor. If you want to specialize in it, you're going to have to like do that post grad and figure it out on your own. And so that was my aha moment. I was like, oh, shoot, I know this is related to the pelvic floor, like incontinence, but I don't know enough. And so that's kind of turned in my deep dive into, okay, I'm going to take every possible continuing education course. I'm going to go through all the levels of certification to become a pelvic floor physical therapist, because I just felt like it was, once again, like a very underserved population. People are scared to talk about things. And then when they finally do have the courage to talk about something, people don't have answers for them, or they don't have a way to help them. And I hated that feeling of not being able to help someone. Plus, I realized if I'm going to be an expert in the musculoskeletal system, I can't be an expert in everything but this like small little part of the pelvis. Like, I wanted to know everything. And so, yeah, it was just working with some of those like female athletes who were having these issues, who had never been pregnant or postpartum. And so that's kind of started my pelvic health journey. But then I really, once I got pregnant myself, I think naturally I developed an interest in optimizing my own pregnancy and postpartum journey. And so a lot of people gravitate towards like-minded individuals. So like, I'm a pregnant person doing X, Y, and Z. And so then I had a lot of patients who were pregnant wanting to work with me. I never imagined I would have an online business like on my own, working with women across the globe. It just kind of happened out of necessity. I couldn't work with everyone one-on-one. It's like, well, how do I get this information to more people? And self-guided course is usually more accessible, more affordable. And so yeah, I just kind of like stumbled upon, honestly, my current online business. But I love pregnancy and postpartum, because usually the advice you get is like, listen to your body, or just give it 6 weeks postpartum and then just ease back into your workouts. And you're like, what the heck does that mean? What does listen to your body mean? What does, ease back in mean? Like, we need some like actual protocols to be able to give women and give them this help, because so many people get pregnant. So many people, once you're postpartum forever. And to just kind of like completely have this population be a black hole of information is just, it's just not acceptable. And so that's kind of why I really wanted to work with this population, is because there's not a lot of good guidance. Like I said, there's a lot of just listen to your body or just walk. But then you also have the other end of the spectrum of some people who are like, well, I'm listening to my body. My body says I can get through any workout. I'm gonna never drop in weight. I'm gonna do the exact same workouts all 39, 41 weeks, whatever. And that's also not optimal too. Like, there's gotta be a middle ground. And that is kind of my goal of all of this, is just giving more tangible protocols for what to do.
I also think it's awesome. You mentioned this, you sort of recently-ish just went through this. How old's your dog?
She just turned 1.
Oh,
She's
she's
getting so
so
big now.
cute. Really
Thank you.
person. Yeah, so you
Yes.
just went through this. So it's not just like Dr. May here is like, esoterically, like you should be doing this. Like, she just went through
Right.
it, which I think is
Yeah.
an angle to have in your practice.
And that was another thing, is I was super adamant about filming my entire movement through pregnancy course while I was pregnant, because there are not a lot of programs out there that actually show like the pregnant body doing these movements. And so it was really important for me to do that, so women could see like, oh, I can do X, Y, and Z. Like, she's pregnant and she's doing it. Or, it just helps to really see a pregnant body doing some of these movements. And then as well, postpartum, looking back on some of my photos and branding photos from the early postpartum shoot, and I was still, nursing Ava and breastfeeding her. And you can see like one of my breasts is so much larger than the other because I had just like fed her one side and hadn't the other. But that's just real life. Like that's just the way it is. It's just really funny. I noticed that.
I love that. It's like, I think we're finally reaching a place, hopefully, in the world where people appreciate authenticity and realness. And like with that also comes talking about these things. And like,
Mhm.
I love that. Okay. So where can people find you, whether they want, and can you explain your offering? So
Oh yeah.
you have a course, you also
Mhm.
work one-on-one, just like let people know how they can get this help.
Yeah, so I treat patients here in Nashville, Tennessee. I'm not currently accepting new patients at the moment, but like that always changes based on, how many people I'm working with. So you can always jump on my wait list. It's all on my website, drmayhughes.com, because I can't work with everyone one-on-one. I've created online programs. So my first one is Movement Through Pregnancy, taking you from week 5 all the way through week 41 of your entire pregnancy with educational modules. So it's not just like here are your workouts and do the research on your own. It's here's exactly what to do. Like week 5, here are your 4 workouts. Week 6, here are your 4 workouts, that sort of thing. And then here's what the pelvic floor is. Here's what you can do if you're having pelvic pain. Like more educational information rather than just workouts, just to help you kind of get through pregnancy without having a lot of pain and to prepare for labor and delivery. And then I have a movement through early postpartum course, which goes through the first 12 weeks of kind of like your 4th trimester of postpartum. And you can actually start at day 1, like in the hospital, because I think a lot of times we do nothing for 6 weeks and then we get 6-week clearance and then we do everything. And so the first 6 weeks are all gentle movement, like stretching, breathing, just reconnecting with your body, that I think really gets missed early on because we're kind of terrified to do anything. But then at 6 weeks, it's this magical, well, I can go back to Barry's boot camp. And I'm like, maybe not quite yet. So then after the first 6 after the first 6 weeks, it's rebuilding like foundational strength, learning, okay, when is an appropriate time to return to run? When is appropriate time to increase my weight? That sort of thing. And then I'm always creating new offers all the time. I have lots of lofty goals of, creating more programs for different diagnoses. But yeah, drmayhughes.com is kind of where you can find all things, one-on-one training, my extensive blog, and my program offerings.
Amazing. Okay, it's so good to see you, and thank you for being on Data Driven Wellness. I know this is going to help a lot of people. I'm even excited. Like I know I'm not pregnant, but like when the time comes, I'm going to be calling you and doing all your courses. So thank you so much.
Yes.
It's great to see you.
Well, thank you for having me. It's always so fun, like I said, just chatting with friends, but also professionals as well. So I just love, I just love this journey that is pelvic floor therapy has taken me on.
So cool. And for any other fellow Commodores out there, anchor down.
Ooh, and go down.
Bye, guys.